Okay, hi everyone. Thanks for joining us tonight. My name is Tung. I'm the lead physio at XR Health. So a little bit about XR Health. It's a virtual reality-based telehealth clinic that provides services in psychology, physio, and occupational therapy. Tonight, Julie's going to be presenting for us. She is one of our psychologists and will be presenting on psychology for autism and more specifically, virtual reality psychology. Take it away, Julie.
Good evening, everyone, and welcome to this evening's webinar discussing VR psychology for autistic individuals. So before we get started, just taking a moment to acknowledge the Wurundjeri people who are the traditional custodians of this land, which is where our main office is located in Melbourne. And we also pay our respect to the elders, both past and present, of the Kulin Nation, and extend that respect to all other Indigenous Australians. As Tung mentioned, my name is Julie Cole. I'm a psychologist here at XR Health, and I've been a psychologist for just over 3 years now, so fairly new to the industry. I was, prior to that, working as a mental health support worker for the NDIS for about 3 years, working for people with a mix of presentations. And before that, I was in the health and wellbeing industry. So I've been with XR Health for about 6 months now and really loving using the VR as an additional tool for my therapy practice. And my passion is in somatic-based therapies. So that's any therapies that combine the mind and the body and the relationship between the two. So VR is actually a great tool and considered a somatic-based therapy as well. As Tung mentioned, we're a virtual clinic providing medical and therapeutic services via telehealth. We've got psychologists, occupational therapists, and physios, and we've got offices in Australia, US, Israel, and Spain. So today we're going to be covering, it's obviously a broad topic, autism in itself, so we're just going to be giving you a bit more of an introduction today. We'll be discussing an innovative approach to psychology, which is virtual reality, and how this may help some of the challenges, including the co-occurring diagnoses we commonly see faced by autistic people. The topics covered include understanding autism spectrum disorder and its associated features, common challenges in traditional therapy settings and delivery methods for autistic people, and how VR psychology is able to help overcome some of these challenges and also improve the well-being of autistic people. At the end of the webinar, there will also be some time for some questions, so feel free to leave some questions in the chat, which Tung will monitor. So what is autism spectrum disorder? Well, it's a neurodevelopmental disorder caused by differences in the brain. It's characterized, according to the DSM-5, by problems with social communication and interaction and restricted or repetitive behaviours or interests. So autistic people might feel a bit awkward during conversations, unsure of how to read and respond to social cues, or have difficulties reading others' emotions. And this can cause some distress for a lot of autistic people and sometimes lead to difficulties in relationships. Or restricted or repetitive behaviours might look like difficulties with change, for example, moving from one activity to another or one environment to another, especially when there's unpredictable situations which might occur, which causes a bit of stress to navigate for the individual. Autistic people might have certain rigidity or fixation on particular topics or situations, which can make it hard to adapt to constant changes in day-to-day life. So as the name suggests, it is a spectrum. So the range and severity of features or symptoms, don't really like that word because it's not really great to necessarily see this as a disorder as such. It's more of a variance of the way the brain functions, but it does vary widely for individuals. So it is important to remember that brain wiring differences are a very normal part of human variation. And I often say to clients that have had a recent diagnosis of autism that it's like they have certain superpowers that they just need the right environment and supports to help flourish. So autism is not something to be treated. Rather, there are strengths and challenges to be considered when exploring interventions that support challenges faced by autistic people. So sometimes it's actually more about changing the environment to overcome these challenges, of course, rather than asking an individual to change who they are or change themselves. And I think that the VR therapy actually does a really good way of creating this or offering this as a way for autistic individuals to express themselves. And it is a little bit of a stereotype, but many autistic people, especially who some of our clients we have at XR Health, love digital technology and working with technology. So again, the VR headset provides a really great, fun way for autistic individuals to engage, communicate, and also, be supported by some traditional interventions. So as I said earlier, it is a broad topic, so we'll just discuss some of the features here today which we which can be supported through the VR, which I certainly found in my own practice or experience using the VR. And so we'll just cover some of them today. So some of these features include difficulties with executive functioning. So this is a set of cognitive abilities that we all have in the brain to certain degrees, different strengths and weaknesses. And we'll explore these in a bit more detail. Challenges with sensory processing. So this is how we process sound, touch, taste, sight, and smell in our environment. Difficulties with socially normed ways of communication, and this can include both verbal and non-verbal in some cases. So we'll briefly explore these in a bit more detail now. So some executive functioning skills, if you kind of imagine it like it's the CEO part of our brain that kind of helps all the other parts of the brain to function. So this can look like our ability to organize information and also take action. So for example, organizing and managing appointments and schedules can be quite difficult for autistic people. They might know what to do in theory, but it can be a hard thing to actually prioritize and take action on. Challenges with managing and being aware of time. So it might take a bit longer to get certain tasks done, or there might be a bit of a time warp happening where someone really zones in on an activity that they're doing and lose track of time. Or there might be a sense of rigidity or inflexibility with time. So being on time or always early and feeling distressed if there's any changes to that time. Our executive functioning also helps with managing and regulating our emotions. So this includes our impulse control. So let's just say an autistic person has a lot of stimulation in their environment and they're changing from one activity to another. They might feel really overwhelmed by all of their emotions. It could lead to a bit of a meltdown or an emotional breakdown because that executive functioning is just struggling to kind of prioritize the information that's coming in to their nervous system. It's also, our executive functioning is also part of or responsible for our ability to focus and have attention. So autistic individuals might really struggle with divided attention. So working on an activity while someone's talking to them at the same time would be an example of that. Sensory processing. So sensory stimulation includes all the ways that our body is processing the environment around us. This includes light, sounds, temperature, sight, etc. So for many autistic people, loud noises, lights, temperature changes, smells, or various body sensations might cause a lot of distress and it disrupt their ability to focus or put their attention on anything else. There may also be, or they might also experience hypersensitivity or hyposensitivity to stimulation. So this might look like lacking stimulation and seeking more stimulation. This could look like fidget toys or movements, stimming behaviors, and this can all be a way of regulating and soothing the individual so that they can focus on the activity at hand. It can also look like being very sensitive to senses or sensory environment, sensations in the environment. So that might look like wanting to reduce or avoid that sensory stimulation. That's where we see the noise cancelling headphones, or just needing some time out away from all the people in the room, for example. Too much sensory input at times, or if this is happening over a long period of time, might even lead to autistic burnout, where everything else kind of shuts down and there's no energy left to do the next activity, for example. And to a degree, with the VR psychology, it's a really good way of actually monitoring and controlling that sensory input, as they can use the device from the comfort of their own home. Communication difficulties can be quite challenging for autistic people. Not only can there be sometimes speech delays or selective mutism, there can also be challenges with reading common social cues or facial expressions, particularly of non-autistic people. But it's not that they, cannot communicate, of course. It just might not be in those socially normed constructors ways that we have in society and in our culture. But of course, if you're struggling to follow a conversation, or you're feeling awkward, or that you might say the wrong thing, or constantly monitoring yourself, that can lead to a lot of distress or anxiety, and also masking behaviors. So masking can drain a lot of energy from someone, and it can also cause a lot of discomfort and a sense of alienation. It can also be a huge barrier to attending therapy in person, because it requires that effort to mask, whereas we really want the individual to feel comfortable to be themselves and express themselves in a way that feels comfortable to them. And of course, with these communication barriers, I'm just recovering from a cold, the thought of going to an appointment can cause a lot of stress, and that might even lead to refusal or therapy refusal. So VR therapy is a really excellent tool to bridge this communication gap, which we're going to discuss in a little bit more detail later. Some of the common co-diagnoses with autism include anxiety, so generalized anxiety disorder. This might just look like worry and rumination about anything and everything. We also see some social anxiety, of course, if there's that fear of being judged in a social environment, or fear of performing and being observed. Separation anxiety, so fear of being away from a loved one or a caregiver. And OCD tendencies, which we often see with kids as well. And that can just be a way that the individual is trying to control the environment to manage that anxiety. And a key treatment for anxiety is exposure therapy, of course. So we want to comfortably expose someone to those fears so that they can build confidence and coping skills in order to overcome them, which VR therapy is a great tool for, because we have over 100 environments we can actually expose that individual to in a comfortable and safe way. Autistic individuals may also be prone to depression. Well, the literature does suggest that in autistic individuals, higher risk of having other mental health disorders such as depression. And this can make sense if there's maybe difficulty identifying and expressing their emotions, which can also lead to challenges with identity and over time cause depression. A sense of social isolation with communication barriers, and also long-term masking. So if you imagine having to pretend to be someone else all the time over time, that can lead to depression also. And a key treatment there for depression is what we call behavior activation. So that's getting someone moving, getting them up and out, or doing something they can enjoy. And again, the VR therapy or the VR headset is a really great way to provide some movement and exercise without them actually having to leave their house. So this can be an additional benefit. And of course, in addition to these, we have a very common co-occurrence, which is ADHD, attention deficit hyperactive disorder, and which is, of course, characterized by poor attention control, hyperactivity, or impulse control difficulties, which there's a strong association here with executive functioning deficits, which of course we see some similarities in the ASD, autism as well. And in the VR headset, we actually have applications or medical applications that directly focus on building these executive skills for individuals, but they're done in a fun way, which we're going to have a look at that in a minute. So some of the traditional therapy methods may face hurdles when catering to some autistic individuals. For example, difficulty managing in-person appointments. So managing that change of environment from, say, being at home in the comfort of your own space in a controlled environment, focusing on an activity, to then having to move and transition to a public space at the clinical practice. And sometimes even just the thought of this can be very distressing for some clients. So knowing they have an appointment the next day they have to get in the car and travel to may cause a lot of anxiety, and they might worry about it all night and then refuse to go to the appointment. This is, of course, not always the case, but it is something that we can see with our patients. So sometimes traditional therapy can be delivered in a linear and conventional way that's just not relatable to a lot of autistic people who might be thinking way more outside of the box or in abstract ways. So of course we know that these traditional methods are evidence-based and effective, but if they're not delivered in a way that that person can relate to, then it kind of can, it doesn't really have the effectiveness that we hope. And the last one here, so there can also be some sensory overload. So for someone neurotypical, a non-autistic person, this might not seem like an issue at all, but for many autistic people, the thought of or the experience of sitting in a waiting room, for example, having other people waiting that it's unforeseen, they can't predict, forced social interactions which weren't expected, talking to the receptionist, sitting in the room with bright lights, or the noise of the air conditioning, or the fabric of the seat and the temperature. So all of these things can lead to discomfort and stress, which might take away from the therapeutic process and limit the communication, and also lead to just a lot of energy that's being exerted to managing the extra stimulation in their environment. The VR psychology also offers a unique solution to these challenges, because we can actually control that the sensory input for the individual to make it more comfortable for them. So why VR psychology, and how can it overcome some of these barriers to traditional therapy? There's flexibility in scheduling in the virtual telehealth. So of course, there's less to organize in terms of transport or getting to the therapy appointment. It's a little bit easier to organize, and they can choose in what room from their home that they're doing the therapy. It's customizable, so we can create experiences that are suited to that individual and their strengths as well, rather than trying to fit that person into a box. So we can really tailor to the individual needs and provide education, for example, in a more engaging way. Through the use of digital technology, of course, which is where it can help get the individual kind of motivated because of the tool, which increases the attention and focus as well. It's a great tool for exposure therapy. So dealing with a lot of the anxieties that we talked about earlier, and also building that person's confidence in coping in certain environments, such as school settings, shopping centres, public transport. So it's without actually having to go to these places physically. And often a therapist would go with their client to do a lot of these exposure therapy activities. But here we can, of course, be with the client through the laptop as they're in the virtual world with the headset. There's also additional benefits as we're doing the VR therapy sessions or psychology, such as improved proprioception, improved motor skills, building strength and coordination, all of which, of course, affect that bidirectional process of the mind and the body. And we see our occupational therapists and physios focusing more on some of these additional or these other benefits. Can also see increased engagement. So, of course, if someone's not engaged or interested in the intervention, that's not going to lead to very good success rates. So, this is another reason why VR psychology can be really effective, also in terms of education. So, there's a much more engaging way of delivering certain topics that we want to discuss, and they might even have an avatar in that process that's actually talking about or educating the person. What is virtual reality? Well, it's a simulated experience that immerses users in a computer-generated environment. And through a process called immersion, the brain actually doesn't know the difference anymore between what's real and what's not, even though it is computer-generated. So we can have the same impacts on mood, emotion, and changing the neural pathways as though the person were actually doing that experience. Through the controllers and the headset where there's sensors, it's actually reading the environment, or the person is able to interact with the environment. And we actually get that data sent back to us from our end on the laptop, so we can monitor the progress in real time. And we can also provide feedback, real-time feedback as well through that data collection. So we're just going to explore now some of the applications that we use, or that the psychologists use, and we'll look at these a few examples in a video in a minute. So we, as psychologists, we use the VR as art therapy. So instead of actually being in an art room using pens and paper, we can use the VR headset. So there's a digital art platform in there where we can create art together. This is really good to encourage expression, play therapy, and also psychoeducation. It's also a great, we often also use this for children and adults that have communication difficulties, so they can actually, express themselves through their artwork. It's a fun way to teach rather than just using a whiteboard as well. So in here we can actually draw out the thoughts or emotions in the characters and then talk about these through the VR virtual art room. Some of the apps we also use just to improve social and communication skills in a way that just takes away some of those other barriers, and it makes it a bit more relaxing for the individual. We use it for mindfulness, meditation, and relaxation strategies. It's a little bit easier for people, so autistic people or ADHD, to just ask them to close their eyes and meditate, for example. In the VR, they can actually focus on certain targets in the environment. So we can really practice that attention control and soothing techniques through the VR. We use it for real-time emotional regulation, so developing and building frustration tolerance for autistic people. They might be doing an activity and make a mistake and get really annoyed at themselves, and in that moment we can help the client to soothe, notice what they're feeling, express what they're feeling. And this, of course, builds an individual's interoception skills, so their ability or their awareness of their internal world. We use it for gradual exposure therapy, as we kind of mentioned before. There's a whole software or application in the headset with over 100 environments that we can use to expose the individual to certain environments that they might struggle to be in. We also use it to improve cognition and executive functioning, so improving short-term memory, working memory, math skills, attention, visuospatial skills, and more. Just having a little look now. I'll just take you through. So this one here, the participant is asked to pop balloons, called balloon blast. So it's more of a physical activity exercise. So, and the practitioners will use this for different reasons. So physio will have their purpose for using this, but a psychologist might use it as a way to build rapport, to get them moving, to get some of that excess energy out, and also to improve executive functioning skills. And we also use it for depression as well, because it's offering that way of being able to move from their own room without having to leave the house. A personal experience of this one. So I was using this for all those other reasons I just mentioned, but it ended up having another outcome, which I didn't intend. It was a mother with her 14-year-old son who was nonverbal. So he could speak, but he would only speak to his mother. And he was seeking additional sensory input. So, you know, a lot of moving and needing to fidget and use things a lot of the time to help soothe. And he got so excited in this activity, he just started talking. And mum almost was quite teary, and she said, you know, she hadn't actually seen her son really ever speak to someone after only a second time of meeting them. So that was really rewarding for myself and mum, of course. Okay, so we'll just have another little look through here. You can see here an application we use for breathing and relaxation, even chronic pain management. This one here, oops, sorry about that. Just bring it through. This one here is a simulated plane environment. So it's where we have a lot of those exposure therapy environments for individuals, whether that's a school setting, heights, a cafe, dogs, you name it. We've got an environment for many different applications that you can imagine. And the good one, excuse me, about this one is that if there's a client that maybe has difficulties with fine motor skills, and they're struggling with the buttons, or an intellectual disability, the practitioner actually takes control of these environments. So it's a bit more passive for the client, and we can control it for them. On this particular platform, there's also a lot of relaxation and soothing applications we can take the client through: body scanning, relaxing muscles, breathing techniques, and many more. Okay, going through a little bit more of these. So under the water, we have different worlds to explore. This one here is a specific tool that we can use for executive functioning skills. It's a memory-based application where the client has to remember certain items and pick them off the conveyor belt. And we've got here the body scanning, swimming with dolphins, breathing exercises. And this one I wanted to show you. Okay, so this is almost like what you see here is more of a group therapy setting, which we don't actually do at the moment. We do one-on-one, but it's a great platform where we actually meet the client as an avatar, so they can create what they look like, meet them in here. We can practice social interaction. We can practice or teach personal boundaries and discuss boundaries. And it's a great way just to have the therapy session in here as well. So one example here, an 11-year-old boy, autistic boy, who had very bad anxiety in communicating and talking. So as soon as someone would ask him a question or he was in a conversation, his mind would go blank and he would just freeze and go silent. And of course, that would lead to refusal to come to a therapy session. So we came in here into this XR Connect platform, and all of a sudden we were playing paper, rock and scissors and swapping seats around, and he just started to talk and open up. He told me all about his anxiety, the fears that come up when he's in the classroom, playing music in front of other people, the thoughts he was having. So it was a really great way to build rapport, and also just to give me a little bit more insight into what he was actually going through so that I could tailor the treatment plan to his needs. So that's XR Connect. And this next one is a very popular one. Yeah, this next one, here we go. I have to say this one probably isn't the best graphics we have here of this. So this is a digital art world, or a 3D art world, where again the practitioner can meet the client in this virtual art room, and we can make art together in a 3D digital platform. So it's a fantastic way for autistic people to express themselves and communicate with the practitioner without that additional anxiety and tension around, sitting in front of or opposite each other in that forced eye contact kind of way. It's also a great way to help identify the person's strengths. So we see a lot of autistic kids and adults very creative, whether that's through their Lego or using graphic design or technology, and it really gives them a chance to show that in this world and also talk about it. We also in here talk about emotions, thoughts, and other educational tools. I've seen kids create amazing worlds in here that have just blown me away. So as we can see, moving along here, VR psychology offers a really transformative approach to therapy for autism, including the co-diagnoses, by addressing the unique challenges and strengths of ASD. VR therapy promotes greater success at times, or accessibility, greater engagement, and of course effectiveness in mental health treatment. It's of course not limited to helping autistic individuals. We can treat people with PTSD, pain management, phobias, or even disorders that have psychosis. There's a range of different presentations that we can address here. We do have a referral process that's quite straightforward through the support coordinator if they're on the NDIS. You contact the office. There will be an initial assessment and some screening just to make sure that the VR headset is suitable. So assessing for contraindications. The VR headset gets sent out, and the client can use it in between sessions, and whenever they want, they can follow the treatment plan as well that we provide on the back end. Different funding streams to pay for the sessions, so whether that's self and plan managed through Medicare or mental health care plan, or private payments. And yeah, that takes us to the end of the webinar. Thanks so much for attending and for listening. And we do have some time now, so for questions and answers, I'll give it back to Tung now so that we can feel free to ask any questions.
Amazing. Thanks, Julie. That was awesome. Yeah, we've got a few questions that have been sent in previously via email, as well as just then. One of our attendees asked, can you help with phobic anxiety?
Phobic anxiety?
Phobic, I guess relating to phobias.
Yeah, so definitely. So we have, there's lots of different phobias out there, whether that's phobia of spiders, of flying, of heights, of people. And so the platform I mentioned before, which has over 100 environments for exposure therapy, that's what we would use that for, to help treat phobias. So yep, we can absolutely help treat phobias through the VR.
Hey, amazing. Katrina asked, what if people are not comfortable wearing the headset?
I guess it depends on which angle you mean that question from. So whether that's comfortable in terms of it's a bit awkward or embarrassing for them, which probably can, someone could probably get over after using it a few times. But if it's more the physical sensations, yes, I have seen that, especially if we look at the sensory sensitivities, so the feeling of the plastic on the head or around the eyes. So we can, the headset is adjustable to make it a bit more comfortable. Might place some fabric underneath it, so there's a little bit less, if there's a feeling of something digging in. We're also exploring at the moment with one client using a projector, so projecting what they're seeing on the headset onto a projector. This could be an option as well. Yeah, so there are ways we could try to make it a little bit more comfortable if they're finding it uncomfortable.
Yeah, amazing. Okay. Let's see. Could you tell us, yeah, there was really interesting success story with the child who was like nonverbal. Someone was just asking for another like success moment with an autistic client.
In any case, or just related to the
Yeah,
communication? Yeah.
it seems like in any case.
Yes. So I would say, gosh, there's thinking of a particular one. I've definitely seen, and this is not just one particular one, very increased confidence. So because we're using the VR tool, and say they're actually, a lot of the kids I work with are discovering things on there that I didn't even know with the apps. And so they're teaching me and kind of sharing something that they're really interested in. So I've just seen confidence lift in a lot of these kids. And where there's been a lot of maybe control behaviors around anxiety that they're having about feeling like different or alienated, through lifting that confidence through the sessions, they've actually also been able to overcome some of those insecurities in real life situations. So that would be one example.
Awesome.
Yeah.
We had Lara asking about for telehealth, would clients purchase their own headset? If so, how much do they cost? I can field this one. It is possible to purchase your own headset. It at the moment it's $660. Typically, what we find with our clients is they will essentially borrow the headset for the duration of them seeing us for our services. And then say, further down the track, it might be after like a month or 3 months or 6 months, whatever that period might be, when they really get a feel for, is this something that I want to do long term and independently? That's when a lot of our clinicians would look at assisting them with getting like headset funded through the NDIS with a letter of support. But yeah, that's how much it costs to purchase. Let's say, oh yeah, Kieran asked about cost, please. So psychology consultations go for 60 minutes, and that's $214.41. And then as for like the headset itself, so if a client is seeing us for one of our services, so it could be psychology every week, or it could be alternating psychology and occupational therapy. As long as it's one of our services weekly, then the headset is hired for free, essentially. Cool. Liana asked if anyone's experienced vertigo from VR therapy.
Yeah. There have been some people. From my experience, everyone gets over it, usually after the first session. So it's just that initial getting used to, and it's probably more of a dizziness rather than a full-blown like vertigo attack, which can sometimes last for hours. But it is something that we would consider in the screening. So if someone suffers with vertigo, we would really just have to trial it. So yeah, but usually it is something clients get over.
Yeah, it's quite interesting because I've had a lot of people myself who have a history of vertigo, dizziness, lightheadedness, and when they actually trial the headset, which we always do in a seated position for from a safety perspective, if they have that history, um, surprisingly a lot of those people are okay on the headset. So yeah, like Julia said, we kind of just have to try it and see what happens. Um, Katrina was asking if the headset is heavy. It's about 600 grams, so not too bad. Most people find it like quite manageable. Let's see. Norris asked, what is the percentage of autism patients that can apply what they learn in and can do in the virtual room into their real life? So I guess, yeah, applying it into real life.
Well, the percent, I don't know if I could probably give you, I might have to look into that and gather a bit of data together to maybe give you an exact percent figure there. But I'll give you an example. So I would say every time, say we're doing just the social interaction environments, usually I always, parents especially, will come back and say that they've noticed improvements with their kids, whether that's just less anxiety in the mornings going to school and having to deal with certain social interactions might be an example of that. And yeah, I just can't think of a specific other one at the moment. But yeah, that's something we're going to have look into, and maybe give you a bit more information around.
Yeah, anything if we need to, get back to the rest of the team for an answer, we can email you guys out. And asked if VR therapy can help with sensory sensitivity such as vestibular, auditory, etc.
Um,
It's probably a little bit outside of like what definitely
we,
what you would do,
yeah.
Julie. I think from a physio perspective, vestibular a little bit because it'll at least help with like proprioception, and help get that like system a little bit better to help compensate if the vestibular system isn't working as effectively. But there are other like physio management techniques for vestibular issues, which wouldn't really work over telehealth. Auditory, nothing really specifically designed for it. Um, so I think that's a little bit outside of
The
yeah, what
psychology.
yeah, psychology and what we're working on. But something we can have a look into and get back to you. Kieran asked, any training for screening and training for allied health professionals? Yeah. So all of our psychologists, physios, and OTs are APRA registered. So they've all completed their relevant degrees. They're registered with APRA, and there's an extensive onboarding process to understand the technology and learn how to use it. And we've all got like working with vulnerable people checks as well. And that includes like police checks and stuff. Um, Sam asked if your VR apps would improve frustration tolerance.
Yeah, definitely. So um, because we can actually get the client to be doing an activity in real life. So for example, the balloon blast that you saw, or there's one where they have to punch buttons and match the colors. And of course, if they miss or get the target wrong, there's a lot of frustration and annoyance that occurs in that moment. So what we really do is encourage the participant in that moment to kind of sit with those feelings and look at it from a different angle. And in a way, we're exposing them to situations where they do fail or make a mistake so that they can build that resilience around their frustrations with making a mistake. So it also that can also, improve their flexibility or adaptability to the environment as well. So that's the beauty of the VR headset, because you're not just talking about it, you're giving them an actual activity through the VR to challenge their skills and to make mistakes.
Yeah, awesome.
Yeah.
Michael asked if there are current VR specifications equipment for that you currently use for clients. Like, oh, okay. So it can't be used by like all of the VR units that are out there. We use the Pico Neo 2 with our software already preloaded onto our units, and we send the units out to you. Yeah, a few, I guess, admin related questions. Chrissy asked if you have two children who are clients and they each would they each get a headset or share one? That would be up to the family, what works for them. So we've had instances of each child getting a headset because some kids don't really like sharing. And then others that were quite comfortable sharing, and we just switch their personal accounts so they can log in with their account and have their own personal data and keep switching that way. Joelle asked how long does the session go for? How long the period of use is, how long is the waiting period for a first session? So how long does a session go for you, Julie?
Well, they're 50 minutes, so that's the standard psychology session. But give or take, it depends on what's happening for the client in that session.
Yeah, perfect. So on our website, it says 60 minutes. It'll be like 50 minutes face to face and ish, and then 10
Yes,
minutes of notes. Yeah.
of note taking. Yeah.
How long of use? I guess that would be dependent on if you're asking for like the total period, it would depend on the client and how long they wanted to see us for. So I've had some clients who have been with me for a number of years now, like 3 years. On average, probably, oh, what would be your average, Julie? Be a bit hard to tell.
In terms of how
How long
often,
you see a client for?
well, I guess most of them stay the whole time. So I've been here for 6 months, or just over 6 months, and I've had clients that started from the beginning.
Yeah.
I'd say there's usually a long, high retention
Yeah, amazing.
rate. Yeah.
Joel also asked how long the wait period is for an initial session. I'll have to get back to you and just see. I don't think there is much of a wait list at the moment. I'll have to double check. I think we've got immediate availability actually, so that's awesome. We've had someone ask if they can't come to your office, how do you assess, like in rural, remote areas? And if I want to train to use VR in my therapies, do I train with you or elsewhere? Um, Everything's done over telehealth. So if you're looking at it from a like client participant perspective, it's all done by telehealth. So all of the screening and initial assessments would be over telehealth. So really fantastic for those who live in rural areas. If you're asking to utilize our our technologies in your own practices, that's something where we can send you an email or actually, this is an anonymous attendee. So if you send us an email to info.au@xr.health, we can start that conversation and see what works for us. Okay, let's see here. Sam also asked, how do the apps improve memory? What is physically changing in the brain?
So when we apply our attention on something, that's where basically the energy goes. And in a way, you could say, excuse me, mindfulness practices and things like that there's studies that show there's a direct impact on the brain by extending the amount of time you can focus on something. And you might struggle at the beginning, but the more you do it, it's like strengthening a muscle, the more that neural pathway strengthens as well. In terms of memory, it's a little bit similar, and we have. I don't know if you saw the conveyor belt going through in the airport there. So that's a particular game focused on memory. So the person is asked to look at certain items for a period of time to remember, and you can change that length of time as well that the items are listed. So you might start a bit longer to allow the brain a bit more time to process and remember that information. And then those items get removed and they have to try to find the items on the conveyor belts. So you would start off on a basic level with that game, for example, and wait until that skill improves or their memory improves, and then we can continue to increase the levels. And so to tell you the exact science behind that and how the brain works on a physiological level, that would be more of a neuro psychologist probably to share that, but it would be an interesting webinar to do just on that.
Awesome. Thanks. Sam also asked, how does XR Health create the applications in regards to programming and inputs from physios and psychologists? So we have an in-house R&D team, research and development team, based in Israel. And I'm not sure on the programming and the software used, but certainly there is input from physios, psychologists, and occupational therapists. And we also are able to like consistently give our feedback to the existing applications so that we can get improvements, which is really nice to have that like really close working relationship with R&D. But yeah, I can't really say what the programming stuff would be because that's like way beyond my understanding of that stuff. So sorry, I can't answer that some more. Let's see. Kieran asked if any of our clients have reported disorientation, nausea, fatigue. If yes, what the approximate percentages? Have you had anyone report that, Julie? Like disorientation, nausea?
No, not nausea. Not nausea or disorientation. More just say really kind of focus on that game, and a long period of time has gone by when they should have had a break. It's just like more of a bit of a a fatigue or maybe a mild headache even. But as soon as they take it off, it's not long before it passes. So it's more, I've had maybe two or three clients that have experienced that. And that's just more because we're in there for a little bit too long or
Yeah. I guess we don't have like stats for like everyone, but say for myself, I've been lead physio at XR for nearly 4 years now. I would say reporting that kind of nausea and disorientation, it's like from those 4 years, less than 5%, maybe even like 1%. So it's a very small amount of people. But we always look out for it because, part of that screening, like we were saying, is whether you do have a history of like dizziness, nausea, vertigo, that sort of thing.
And that's why we start small. You might only do 10 minutes at the beginning to get used to it, and then you can just build that resilience to it over time as well.
Yeah. Sam asked if VR has been used to access suppressed memory with success, like a traumatic childhood event. What might be displayed in the headset in that instance?
I'm not aware of that. That would be something to, as far as I know, the research on it, VR, I haven't seen that, but it certainly is used to help treat PTSD. We don't, I think, have specific applications on the XR Health headset that would focus on that.
Would it be like one of our like other psychologists who might say specialize
In
more in that?
suppressed memories or trauma.
Yeah.
Yeah, we could definitely look into that.
Yeah, because we do have a pretty big number of psychologists, all with different sort of specialties and interest areas. So something that we could come back to you with that answer. Um, we've got only a few minutes left, so apologies if we don't get to your questions. Joa asked if this would help a child with Tourette's with 8 tics happening at once.
Um, I actually am not sure on that one. So with Tourette's, it's not an area that I have focused on or treated. So it's probably specifically Tourette's a bit outside of my scope. So I personally wouldn't be able to answer that one. But again, it's something we could look into.
Yeah, and we'll come back to
Mm.
send you an email, Joel, and ask some of our other psychologists to see if they've had some experience with kids with Tourette's. Joel also asked, could a child's anxiety increase or have stronger behavior issues? Have you experienced that so far?
Have an increase in behavioral issues, did you say?
Yeah, an increase in anxiety or have stronger
Um,
behavioral issues.
No, I haven't seen that. Unless, of course, if we're doing exposure therapy where we're expecting an increase in anxiety, but that's intentional and it's done in a controlled way and in a safe way where you're not actually flooding the individual. So no, I haven't seen, and maybe you might even be referencing there or relating to screen time. Kids that have been on the iPad for many hours, and then see an increase in anxiety or behavioural issues. But I haven't seen that with the VR, especially. It's a medical device too, so all of the applications on there are the intention is to use for therapy. So I haven't seen that.
And a good thing is we have like full control during the session. We've got like a program that us as clinicians we use to connect to the headset and say if something was to start happen that wasn't intentional, we could stop that immediately.
Yeah.
But yeah, like Julie said, nothing that has been reported to us. So yeah, haven't really experienced that so far. Um, yeah, okay. I think we got time for one last question. Sam also asked, what does an app that treats PTSD look like?
An app that treats PTSD look like? Okay, um, so with PTSD, there's kind of like stages involved in the treatment. And the stage one of that would be stability and safety. And so that might just look like creating rapport and communication and focusing on the relationship between you and the practitioner or the client and the practitioner.
Yeah.
So the VR can be used as a tool in that way. So any app really as a communication and rapport building. And there's also relaxation and mindfulness applications on there. So we're helping the person to build their ability to sit with uncomfortable emotions through regulating their emotions and practicing mindfulness techniques. And then, of course, it depends on what the actual, what the PTSD was. It a big event that happened, or was it lots of little things that happened over time? And so, if it was a big event, and say, but maybe there was a car accident in the Amelia app, or what we saw there with the flight simulation, with the over 100 environments. So let's just say someone had a car accident and they're too scared to get back in a car. We might slowly build or have PTSD around cars. We might slowly build their confidence in getting into a car through the VR and using those relaxation techniques while they're in that simulated car. And to retrain the brain basically that not every time they get in the car it's going to lead to an accident. So that would be one application there, or a couple there, I think I mentioned.
Perfect. Alrighty. Thanks so much, Julie. Thanks everyone for attending tonight, taking an hour out of your evenings. Really appreciate it. The next webinar in our series of webinars is going to be, let me double check. I'm sure it's same time in 2 weeks, but I'll be presenting on chronic pain and how I, as a physio, might utilize the VR headset to help those with chronic pain. But yeah, please get in contact with us if you wanted any like further questions answered, or yeah, individualized demos. But yeah, thank you so much for joining us tonight.
Thank you, everyone. Thanks a lot. Thanks, Tung.
Thanks, Julie. Bye.
Bye.